Dr. Elizabeth MacDonald from Grand Lake Veterinary Hospital, and I'm just hopefully going to tell you a few things about your pet's upcoming dental and what goes into it and why. There's a lot of confusion about dentals, and lots of times people think that all we do is clean teeth, but it actually is oral surgery and a lot more than cleaning teeth. Dentistry can be really a little bit scary and a little bit confusing, especially when you get this estimate that has this huge range, and we're going to talk a bit about that. What goes into a dentistry, what happens before the dentistry, and why we can't always tell you ahead of time exactly how much that's going to cost. First off, you already most likely came in for an oral exam, and your doctor told you that something was going on in your pet's mouth and we needed to clean it. It's not just a cleaning though, because we are going to ultrasonically scale underneath all of the gingiva and try to get rid of all the bacteria and disease that is underneath the gum line. Before we do the dental, we actually are going to make sure that we have run pre-anesthetic blood work and evaluated that blood work and made sure that your pet is stable to go to surgery. If you have a cat, we most likely are going to have run something called a pro-BNP. That's a cardiac marker that's going to show us some of the hidden diseases that cats don't always let us hear when they're in for their annual exams. We also are going to send you home with medication before dentals. And most of the time that medication is going to include a pain medication and an anti-nausea medication. The pain medication is great because it doubles as an actual anti-anxiety. Once your pet gets here, we are going to give them some more pre-meds so they're less stressed, and then we're going to put an IV catheter. All of our patients are monitored with an EKG that measures their heart rhythm and shows that rhythm that you're used to seeing. They're going to be measured with a pulse oximeter that helps measure their oxygenation status. They're going to be measured with an end-tidal CO2. That's actually an anesthesiologist and our favorite piece of equipment because it tells us real-time how well your cat is oxygenating. We have dedicated staff that are just monitoring your patient while they are under anesthesia. So the people who are cleaning the teeth or taking the x-rays or developing the x-rays are focusing on those things, while one person is dedicated only to monitoring your pet's needs while they're under anesthesia. When we take a cat to dentistry, lots of times it just seems like we're going to clean their teeth. That's actually not what we're doing. We're actually using an ultrasonic scaler to get under the gum line and ultrasonically clean their gingiva and simultaneously sterilize all that bacteria. Then we follow that with full mouth x-rays, and full mouth x-rays that allow us to assess what the teeth themselves look like and if there's any disease or any painful disease. Now, in that pre-anesthetic appointment, we generally can give you an idea of how bad it looks, but we get caught by surprise with some frequency, in part because there are actually quite a few teeth in the mouth we can't actually see well in an awake dog. So we're going to talk a little bit about what's unique about cats. The answer is basically everything, but we're definitely unique when it comes to actually cat teeth. So cats actually have a very special kind of dental disease that dogs in general don't have. And behind me are pictures of actually normal cat teeth. And we're going to talk a little bit about what goes into dentistry and why x-rays are important and why it's a little bit different when we're dealing with kitties. So this is actually a normal x-ray of a lower molar of a cat, and you're looking at the 3 teeth that the cats have on the lower jaw that don't include the canine tooth and the little tiny incisors up front. These teeth all have 2 roots, so 1, 2, 1, 2, 1, 2. We take x-rays because that's not actually always the case. Sometimes cats don't have 2 roots. Sometimes the roots are hooked. And the other thing that you see in this x-ray is this big tunnel. And that big tunnel is important because that big tunnel houses a huge artery, nerve, and vein. And when we go to extract teeth, we actually have to drill away bone to get the teeth out. And we want to make sure we're not going to hit those artery, nerves, and vein. And when we talk about pulling teeth is actually oral surgery. These teeth are really cemented in there. And so we actually have to do something called a gingival flap, remove that flap down, drill away some bone, and wiggle these teeth out, straight up and out. But I'm going to show you an example of where we don't actually do that in cats. So cats are special in all things. They don't have the same drugs that dogs do or humans do, and they don't have the same teeth, and they also do not get the same diseases. The next slide I'm going to show you is a really great picture that Dennis published, and it's actually showing you an x-ray next to what you see in the mouth. So when we are looking at your cat ahead of a dental, we're often looking to see if it looks like nice pink healthy gum is there, or we're seeing pink gum kind of growing up the teeth. And in this case, it's growing up the teeth and into these holes. Those lesions are called resorptive lesions. We actually think it's an immune-mediated disease. And the big problem with this disease is we don't know how to prevent it. We have some ideas, but they're just that, they're ideas. But we do know that when your cat's tooth looks like this and the radiograph looks like that, the only way to actually resolve that issue and prevent the pain that they're currently feeling is to pull that tooth. Now, pulling that tooth sometimes means getting the whole root out. In this case, you'd really want to get that root out. But sometimes you can't actually see the root. So here's that same tooth. I always call that tooth the canary in the coal mine tooth. It's the lower front premolar in a cat. It's often the one that gets taken out first, not always, but often. And you can see here these normal teeth, and then you see what should be the roots here, and they actually look like they're moth-eaten. So there are a bunch of little holes eaten out of them, and that's actually the cat's immune system destroying and attacking their own teeth. Now, when the immune system does that, and there are these holes up here, that means air is actually coming in contact with those nerves. So these are unfortunately painful lesions, and we do like to get them out when it's at all financially possible, when we notice that they're there. So, but sometimes we're not actually going to go for those roots. So this is a case in which you really can't make out the distinction of those roots. We might do something called a crown amputation, where we take out what we can and we close that gum and it heals over, and when that root is no longer exposed to air, it doesn't hurt anymore, which is great. So when we do dentistry here at Grand Lake Veterinary Hospital, we anesthetize our patients, we clean their teeth, we take full mouth x-rays, we assess those x-rays, and then we decide what teeth are either causing discomfort or have abscess or need to be pulled. Now our hope is to do all of this work and get all of these painful teeth out, and then give you the tools to not have to do dentistry often. After we clean your dog's teeth, we are going to send you home with pain medication if indicated, antibiotics if indicated, and instructions for post-anesthesia and post-op care. If you had teeth extracted, we're going to schedule an appointment about 2 weeks out to look at those extractions. Now those sutures that we put in, those are actually going to dissolve on their own, but we want to make sure that the wound itself is actually healing. And we're going to want to make sure that after you do all of this care for your dog's mouth, we give you the tools to make sure you can try to maintain it in a whole variety of different ways. Lots of times that's going to be chewable treats, sometimes that's going to be water additives, sometimes that's going to be algae, sometimes that's going to be brushing teeth if you guys can. After surgery and your pet goes home, they're often going to be groggy for a couple of days. I always say that my dogs aren't annoying again for usually 2 days, even after a routine anesthesia with no extractions and nothing that was actually painful. However, when you go home the night after surgery, it's always shocking how much dogs usually will eat. Now, it's really nice if you had extractions for you to soften the food, and we usually will tell you to soften their food for about 3 to 5 days, maybe a bit longer if you had a lot of extractions. So softening the food is one nice thing to do, and making sure they have a quiet place to rest, to sleep off that anesthesia is great also. One of our staff will call you the next day to check in, and if you haven't heard from them in the morning and you're worried about anything, please give us a call back and let us know that you're worried. We are always happy to make sure we recheck a patient and make sure everything is going well and you have all of your questions answered.